I look great in the
Hi, Melissa.
Hi, Melissa. Sorry. Okay, so we're doing our teaching project over safe sex. So basic like contraceptive use and STD prevention. And we're doing it to a sorority on campus of 120 girls, and their ages are 18 to 22. We wanted to talk about this with them because it's Rachel and I's sorority, and we've had quite a handful of girls pregnant since we've joined in like the year before, and we all have a lot of friends in other sororities, and they have the same problem. And then we just we have a lot of people come in and talk about like health issues, but we don't really have people talk about STD prevention and stuff like that. So we thought, let's kill two birds with one stone. Our objectives. Oh, and we'll start off by like introducing ourselves to them and telling them what class we're taking and all that. Our objectives are to inform the risks and prevent the occurrence of unsafe sexual behavior, to prevent unplanned and unintended pregnancies through the teaching of contraceptive use, and to prevent the spread of STIs and STDs through the education of clinical manifestations, risk factors, and prevention of the most common diseases present in today's society. So we have 10 questions that we're going to show them before and after to see like what they've learned from and what they know beforehand. I'll just read some of the questions so you have an idea. One of them is, what is the most reliable way to prevent pregnancies and the spread of sexually transmitted infections? A, monogamous relationships. B, condoms. C, abstinence. Or D, only participating in oral sex. C. Another example is true or false. A condom may break if the tip is not pinched to remove air bubbles. Another one is, what is the most commonly sexually transmitted infection? And we have HPV, gonorrhea, HIV, or chlamydia, and it's HPV. So we'll do 10 of the same 10 before and after. And then Rachel starts talking. So here's Rachel. You can see her.
Melissa. So I'm going to basically start with STIs and just like share.
Hold on, Rachel. Talk.
Okay. Can you hear me?
Yeah, we'll hope
better.
So. Okay. So basically sharing that they're bacterial infections. And I'm going to cover chlamydia, trichomoniasis, and gonorrhea. And for each of these, I'm just going to go over what it is, some of the common signs and symptoms, and, even if they are asymptomatic, risk factors and prevention, the importance of getting tested, and basically just going over an overview of them. I can give you kind of an example of how one will go. Just sharing, like with chlamydia, you're going to have painful urination, lower abdominal pain, discharge, painful sexual intercourse, bleeding, and then just going over risk factors that are coincide with them. So basically things that they need to realize, like put them at a greater risk of having these infections. And then also treatment. And do you guys want me to go over any more?
No, she has an idea. So you have 4 different ones you said, right?
3.
Mm-hmm.
Okay. So then, Lauren, tell me when you start, right?
Let me go to HIV.
Okay.
And then I'm going to cover the more viral STD, STIs, however you want to go over it, like HPV, HIV, and herpes. And I'm going to do kind of the same thing as Rachel, what they are, how you can prevent them, the signs and symptoms, and if there's treatment options available. Like with HPV, I'll explain that the actual name for it, how it's a group of 150 related viruses transmitted through skin-to-skin contact in intimate situations. And it's so common that nearly all sexually active people will get it at some point in their lives. And it can be passed even if there's no signs and symptoms. Then I'll go into the signs and symptoms, like you might get genital warts, cervical cancer can develop, and other types of cancer. Then we'll go into treatment, like there's no treatment for it itself, but you can treat the manifestations like the genital warts, the abnormal cervical cells, the cancer. And prevention's always better than treating it. And then go into vaccines that are available for both girls and women, and then boys and men. And that'll be it for like HPV, and then I'll move on.
And then we're going to move into pregnancy, and how about half of all pregnancies in ages 20 and older are unintended. And so we'll talk about the birth control. The first birth controls we talk about are the IUDs, and there's the copper T intrauterine device, Paragard, or we have the Mirena, and how one of them is with hormones, the other doesn't use.
More copper used.
The next is hormonal methods, and this is the implant, the depot shot, the patch, and the vaginal ring. And we go into what each entails. Like the implant is a single thin rod that is inserted into the skin of the woman's upper arm. The rod contains progestin that is released into the body. Talk about how long each one lasts. Like the implant lasts 3 years, the injection is 3 months. Talk a little bit about costs and failure rates.
We go in like depth more of the most common contraceptive methods, so hormonal methods including the pill, so like that you need to take it every day, and the difference between the combined pills and just the progestin. We also talk about how it's easy to get, how you can get it at Planned Parenthood. You need a prescription, and the cost with that. And then we talk about condoms and kind of just like where you can get those. So then we're going to have Rachel demonstrate how to properly put on a condom. And then we kind of talk about the fertility awareness-based methods. So just like following, it's like, okay, your failure rate is going to increase a whole bunch, but just like a woman understanding like how her monthly pattern works and all that jazz. I think you're supposed to be doing this. I'm sorry.
Okay. Then we go over to prevention tips. I'm not sure if you want to do this, Rachel, or not. You wrote this slide, but I can just go over it right now. How the number one prevention from STIs and unwanted pregnancies is abstinence. Number 2 is a monogamous relationship. And number 3 is use of condoms. And then we go into the on-campus tips, how they have free condoms and dental dams available at the health center, and the STI testing available at the health center. And we give the links that more information can be found on.
And then we do our post questions again to see if they learned anything, and which they will. And we were thinking about maybe like getting some condoms and like passing them out, like if they answer them right.
Condoms for participation.
Yes. And then we chose, I forgot to say that we chose like the STDs based on like what were most prevalent right now. So we found like some scholarly journals, and they said which ones were most common. So that's why we chose those. But that's all we wrote.
That's what you wrote.
Okay.
Thank you.
Bye.